What's motivated me most at this Winter Institute is seeing students that want to get better understand that there's a different way to look at something. And I think that everyone that comes through the DAT program here is very motivated to learn and to get better. My career path, I was always interested in medicine, some sort of field that worked with healthcare. And I grew up as an athlete. I played soccer, I played ice hockey, as far as organized sports. So I thought that that was a nice merging of my interest for healthcare as well as being a servant to the physically active population. I found an opportunity to specialize my care and be a little less of a generalist athletic trainer and focus particularly on one area I was very passionate about, which is head injury and concussion, and found a job at Northwestern University that I started just over a year ago. And that position is located within the Student Health Center. So really that passion that I developed for treating the physically active population, but not necessarily those that have the access that athletes have. I was really drawn to the ability to serve the entire student population, and anyone that may suffer a head injury that comes through Student Health Services has access to myself as an athletic trainer and our services for concussion management. When the program was first available, I was one of the first to enroll into the DAT program at ATSU with an eye towards developing my ability to conduct advanced practice leadership. And now that I've graduated, I feel like that has been something that's been useful for me. Some of the tools, if you will, that I developed throughout this program were really enhanced by the courses, and particularly the Winter Institute was something that I was very interested in when it first came out, and really enjoyed when I went through it 2 years ago. What I enjoyed about the Winter Institute with the DAT program was that everything up to that point had been online. So it was the first time that I got to interact with the faculty, with my cohort of students in a face-to-face manner, and really in an immersive, intense, week-long environment that had specific focuses each day regarding content and trying to advance the level of the understanding we had of the profession, as well as the various content that we were addressing each day throughout the week. And particularly at the Winter Institute, being able to come together within small group activities and focus on individual questions that mattered to us and that were important to our patients and to the profession. The way in which we utilize that network and that community of practice is sharing our experiences in collecting outcomes data on our patients and being able to demonstrate the value of the work that we do. And once we can do that amongst each other, then we can progress that out to the profession. So I think that things that we've done here at the Winter Institute and at A.T. Steele University through our Doctor of Athletic Training program as students is to recognize the role of athletic trainers more in public health rather than just the athletics-based model. And I think that that also will help with elevating the respect and the recognition of athletic training throughout the public. The kind of person that does well in the DAT program is the person that recognizes that our patients are patients, not just athletes. That can be anyone from the community, particularly those that are underserved. I think this DAT program is about having a reason for what you do, being able to measure that and affect change within patient care, within the profession, within yourself.